Okay. Welcome, everyone. Thank you for joining us today. My name is Jessica Shape. I am the Marketing and Development Manager with The Time to Heal. I want to thank our title sponsor, Nebraska Cancer Specialists. Oh, and I think I'm missing their slide here. There we go. Our title sponsor, Nebraska Cancer Specialists. They sponsor each of our Create Your Best Life events, these webinars that you're attending today, including this session here. For more information, you can visit their website at nebraskacancer.com. Joining us today is Alex Eilers. She is a doctor of physical therapy. She is currently practicing at Madonna Rehabilitation Hospital in the oncology unit. And I'll stop sharing my screen here so you can take a look at Alex. There she is up in the corner. Perfect. Accredited by the Commission on Accreditation of Rehabilitation Facilities. Okay, there we go. So Alex completed her undergraduate career at the University of Nebraska-Lincoln and later earned her doctoral degree in physical therapy from the University of Nebraska Medical Center in 2019. With over 2,000 hours of experience, she provides comprehensive care and rehabilitation to oncology patients, expertly managing their treatment plans with precision and compassion. In her spare time, Alex and her fiance Donovan are planning their wedding scheduled for January 2025. So please welcome Alex. I'll ask her to unmute here so she can chat with us.
Hello, everyone, and thank you, Jess, for that great introduction. I'd also like to say that I'm really excited to be here to present this topic. It's something I do every day and have seen work really well. So if I can encourage you guys to take one step today towards more activity to affect your fatigue, then I will be really, really happy. So with that, I think I'll go ahead and share my screen and get started. Okay. So are you guys seeing my slides? Yes, awesome. So again, there's that today we're going to be talking about managing cancer-related fatigue with exercise. I will also provide a couple other tips in order to just go on to a healthier lifestyle in general. And so today we'll have these different objectives that we'll hit. I'm going to grab my laser pointer so you guys can see what I'm talking about, but each one has a little symbol that I've assigned to them. So first we'll define cancer-related fatigue, or also known as CRF. We'll discuss exercise guidelines for cancer survivors. We'll identify ways to track exercise activity and side effects. We'll highlight some resources. Some are free, some come at a cost, but kind of point you in a direction to kind of start. And then for those professional people, will demonstrate the use of screening tools so that we can there's some really good research on what we should be doing. So I wanted to make sure that those professionals are aware of some of those tools. So first, we'll define cancer-related fatigue. Cancer-related fatigue is different from your day-to-day tiredness in that it's not proportional to recent activity, interferes with functioning, and is not relieved by rest. And this is the most accepted definition of CRF. It comes from the National Comprehensive Cancer Network, NCCI, and I see it quoted pretty regularly when in the research regarding cancer-related fatigue. So again, not proportional to recent activity, interferes with functioning, not relieved by rest. And so the next question is, why does this happen? What causes CRF? And really, there is not anything well demonstrated physiologically in the research. So possible causes include inflammation. So with an inflammation reaction, it co-occurs with pain, insomnia, lethargy, altered mood, cognitive impairment. So that all, can be kind of grouped together as the word fatigue in general. It could be due to disrupted cortisol regulation, which cortisol is your stress hormone. It kind of gets you a little bit more amped up, kind of the opposite of what relaxing and recovering is doing in your body. it could be due to reduced energy metabolism. So there is some idea that with treatments, the sarcoplasmic reticulum and mitochondria might be affected, which that is the powerhouse of your cell. Those are in each single cell of your body, and that is what provides energy to each single cell. So if you're not able to create the energy needed, that could also cause some fatigue. Comorbidities, so anemia. So if you have low red blood cells, a known side effect is extreme fatigue. If you have any cardiac conditions, it means your heart isn't pumping the energy and nutrients to your muscles, to your cells. So it causes tiredness. Diabetes can also have a secondary symptom of tiredness or fatigue, or any psychiatric conditions can also cause some type of difficulty with activity. Cancer treatments themselves can cause fatigue, including hormonal, chemo, and radiology. It has been shown that the trimodal treatment often reports more fatigue. And then, of course, psychological factors, including history of depression or catastrophizing and fear of recurrence, can also cause that tiredness. But really, it is a multi-factorial problem. Of these possible options could be overlapping. So you might have more than one that is causing this fatigue, and each person might be reacting to this process differently. So it could be different from person to person, which ones are really, really highlighted for your specific reason for why this fatigue is going on. And so one thing that does work on all of these possible reasons for fatigue is exercise. And so I want to go into why that is. It seems a little counterintuitive to me because let's say you have, like we said, it's unrelenting, it doesn't go away with rest. So you go down, you say, I'm really tired, I'm going to take a nap. You lay down for 20 minutes and you wake up and you still have that heavy weight on your chest that feels like you can't do anything. So my initial reaction would be, okay, I'm just going to rest a little bit more. I'm going to do less physical activity. Well, if that becomes your habit, you become deconditioned. And with that deconditioning, your day-to-day life tasks become more challenging. You don't have an energy reserve to complete those necessary tasks, which actually leads to more fatigue. And so you do less physical activity, you become more deconditioned, and it just becomes this spiral of fatigue that is just unrelenting. It seems like you can't get out of it. Well, what can we do to change this? We can increase our physical activity or maintain. Really, it's not necessarily a marathon thing. We just want to do enough to maintain our physical activity. And that can affect our conditioning. So we become less deconditioned, more conditioned, and our daily activities become easier. And so that is what has been shown to be most effective with this fatigue. And so any questions on that specifically? Okay, so we just gave a little bit of background on what is fatigue, how can we affect it? And so I want to talk a little bit more specifically about that exercise and activity recommendations. So this here is a graphic from the ACSM, which is one of the best resources for exercise prescription. And so we'll go into detail about this. It's a busy graphic, but it gives a lot of really good information. But first, and so it comes from this clinical practice guideline, which has been endorsed by many organizations, including the American College of Sports Medicine, the American Cancer Society, that NCC, one I mentioned earlier. A lot of those big name players in cancer research have either been a part of this creation of the roundtable or have endorsed its findings. So this is an updated version from the first one, which stated that exercise is safe for cancer patients and it recommends as much as possible. And this one kind of goes into a little bit more specific of what exactly should we be doing for different symptoms. But first, I want to talk about the considerations for exercise, because there is a time and place to do exercise, and then there's a time and place not to do it. If you have any arm mobility and upper extremity lymphedema symptoms, it may be important to seek some guidance on what exactly what exercises you are completing. If you have any bone metastases that affects the actual structure of the bones, they become a little bit more porous and more likely to break. So you want to make sure you're doing less, you're not doing any jumping, high impact activities. So having someone kind of oversee your program would be important. If you have any neuropathy, so changes in sensation in your feet, so numbness, tingling, unable to feel them, you may be at higher risk for injury because you aren't getting some of those, you don't have as much awareness of where your feet are, and you also might might not receive some of those pain signals that a normal sensation would allow. If you have an ostomy, you want to make sure that your core exercises are maybe overseen. Also, changes in pressure can affect that medical piece of you. If you have anemia, that is a actual physiological reason for your fatigue, and it needs to be treated before you start exercise to be the most safe. If you have a current fever or infection, it will affect your ability to exercise. So knowing that, you would want to do something different than your day-to-day stuff. Or if you have a recent surgery, there are a lot of things to consider when you're doing. So definitely seeking more advice. With any of these or anything else that causes you concern would be a great question for your medical team before you exercise. And so also, overall, cancer population can follow the exercise testing requirements of the general population. But so I'm going to go in through, there's like 3 kind of tiers of things to kind of look at here. So if you don't have any comorbidities, no further pre-exercise medical evaluation is recommended, and you should follow general exercise recommendations. So that's great. It means we're ready to start. If you have peripheral neuropathy, arthritis, musculoskeletal issues, poor bone health, or lymphedema, you may need a pre-exercise medical evaluation, which can be some type of just questionnaire to make sure that we're making sure everything we're doing is safe for you. And then you may want to consider referral to a trained personnel to make sure that you're doing exercises that are safe and will benefit you the most. Including like a physical therapist or even a exercise professional that has some training in cancer population. So they do have certifications for personal trainers. And so that would be something I would look for if you were specifically thinking about getting a personal trainer, is asking different places, do you have anyone trained with a cancer certification thing? Because then they'll be able to address a lot of those issues.
Alex, if I wanted to add that we have a great friend, Amy Rue, with the Live Strong program at YMCA. So for the folks that are local to Omaha or have a YMCA nearby, the Live Strong program is specific to cancer survivors and offers exercise support with this added layer of consideration for survivors. And they also have some great resources on their website. So please keep that in mind if you're here and wondering where to start. And Alex, before I jump back to you, we do have a question in the chat, if that's okay.
Yeah, sure, go ahead.
So besides changing doctors, how can I get my doctor to address my low blood cell count? She says that my count isn't low enough for a transfusion. You know what? That might actually be something that we could answer separately. That doesn't seem quite like it would suit the exercise side of that coin. What do you think, Alex? Is that okay if we take that one offline?
Yeah, I think I do not have any information on blood cell counts. That's a little bit out of my scope. My thing is I can refer you to a physician.
Okay.
Yeah, second opinions are good too.
Thanks, Vicki. We'll get back to you separately. Alex, as you were, please continue.
Yes. And so now we're kind of on that third tier of the most severe comorbidities, including lung or abdominal surgery, ostomy, cardiopulmonary disease, ataxia, which is uncontrolled movement. So like you might miss your target when you're going to tap something. extreme fatigue, which may be what we're talking about today, severe nutritional diet deficiencies, worsening, changing physical conditions. So then definitely having a pre-exercise medical evaluation and clearance by a physician, and then referral by a trained personnel. So definitely want someone overseeing your program to make sure that they're adjusting it appropriately. But overall, the benefits of exercise and physical activity greatly outweigh the risks of adverse effects. So, there are some considerations. Most of them were not reasons to not do exercise. They're just reasons to kind of key in a little bit more to something specific. But we want these benefits. We want the reduced anxiety, fewer depressive symptoms, less fatigue, right? Less fatigue is in all of these categories: better quality of life, improved perceived physical function. So this kind of breaks it down into 3 separate categories, which we'll carry throughout the rest of this presentation. So the aerobic category is that it's affecting your cardiovascular system, your heart. It is repeated movements with a goal of increasing your heart rate. Another sign that you are increasing your heart rate is you might lose your breath a little bit. So you might have to breathe in a little bit deeper. You might become a little bit more challenging to talk while you're doing this activity. That's a good thing. That means you're getting that aerobic activity in. Resistance is providing some sort of load to your system. So it can be through weights. It can just be, you can use your own body weight for this resistance. You can use bands. But something that is you're working your muscles through a range of motion. So a bicep curl is a great example of you're lengthening this muscle and then shortening it with something. You can do it with body weight. I could be holding a weight. That would be your resistance training. And then your aerobic plus resistance is just combining those two together. And this has been the best in most studies. That combined activity usually they both have significant changes, but the combined has a little bit more greater change. So if you're looking for the most bang for your buck, you want to do both. But I also want to talk a little bit about how we prescribe exercise. And the American Heart, the ACSM, or this guide we're using, uses the FIT protocol. So it stands for frequency, intensity, time, and type. So when you're asking, what should I do for exercise? You should have these 4 components to it. So what is frequency is when. So how often? So for the cardio or the aerobic training, you want to do it more than 3 times per week. With the resistance training, you want to do it greater than 2 times per week on non-consecutive days. So you want a rest day somewhere in the middle. Intensity, how challenging is it? Specifically for fatigue, and this is very specific for fatigue, you want a moderate intensity. We'll talk a lot about how do you know what moderate intensity is in coming slides. But higher intensity may have increased results in other areas other than fatigue. So you can do higher intensity. You may see different effects, but you definitely will have a positive outcome with those. T for time. How long do you do this exercise? And so the general guideline is 150 minutes per week. And that can be split up in any amount per day. One other caveat is you want to do at least 10 minutes. In the research, it shows that after 10 minutes, you start to have cardiovascular changes to your body. And so that is some physical signs that you are making a change in your body. And then type. So what are you doing? And so we're either doing aerobic, resistance, or both. And really, this recommendation for the cancer population mirrors the generalized exercise recommendations by the American Heart Association. So, what should anybody be doing? It's kind of, these are the guidelines that we have. And so here is that nice thing from the ACSM, that it's a very busy slide, but it breaks down specifically what are the results you're looking for. Are you looking for cancer-related fatigue outcomes? Are you looking for health-related quality of life? Are you looking for physical function improvements, anxiety, depression, lymphedema? And all of those have strong evidence for exercise to improve them. Some things with moderate evidence that might need a little bit more research to them for some reason. Yeah, it says insufficient evidence for here. So is bone health and sleep. So they may have an effect. It definitely won't hurt these areas, but the strong evidence is up in the pink. But like I said, we're talking about cancer-related fatigue. So again, we'll go into a little bit more detail into this top headline of the graphic.
Alex, I just wanted to add that if possible, we can make these slides available to folks after the conversation, if that is acceptable to you.
Yes, definitely.
Yes, so everybody that's attending, we will do our best to get these slides to you within the next week or so that you can have access to this and zoom in if you need to on some of these great slides that we've got. And I'll let you get back to it, Alex. Thanks.
Yeah, sure. And so specifically for the aerobic, we're going to walk through this, the fit. It's the recommendations written in a sentence here, but we're going to go through our terminology that we just learned, with frequency being 3 times per week, intensity being moderate, time being 30 minutes per day, and type is aerobic. So hopefully I'm starting to sound a little bit repetitive because, this is kind of, like I said, mirrors that general population recommendation. And so for the resistance only, you want to do it 2 times per week on non-consecutive days. You want to do moderate intensity. You want to do 2 sets of 12 to 15 reps. And you're at the correct weight is when that 12 to 15 reps gets challenging. When you feel like you can't do another rep, then you're right at, and you can do 12, then you're right at that right weight. And then the type is resistance. So we talked a little bit about lifting weights, doing body weight resistance bands. Even like pool walking can provide some resistance. And then the combination is just those 2 added together. But again, so I just want to highlight the biggest difference with this section is that moderate intensity. And so how do you know what moderate intensity is? And so I want to identify ways to track your exercise, activity, and side effects. And so moderate intensity, we're going to use this scale. There's actually 2 scales here. It's 1 to 10 and 6 to 20. And those numbers are kind of weird, but they're supposed to simulate your heart rate. So if you add a 0 to all of these numbers, then your 60 beats per minute is very low resting heart rate. Even 70 beats per minute is pretty low resting heart rate. But if you are up to 200 beats per minute, it's probably time to go to the doctor because that exceeds the normal range. But for moderate intensity, we're looking for somewhat hard to hard. So less than 6 on this 10-point scale, or 13 to 15 on the 6 to 20 scale. So if you were to put a word to it, it'd be somewhat hard to hard. If you were you could talk if you were doing this aerobically, but it might be a little bit more challenging. So you might just start doing 1-word responses instead of like a conversation. And then if you're getting into more of the scientific range, you're doing 65% of your heart rate max for the aerobic condition and the cardiovascular condition, or a 60% of your 1 rep max when you're lifting. So if you were only able to do 1 rep of this weight because it was so heavy, you would want to cut that almost in half, and then you would be in that 12 to 15 range. And that's getting a little bit in the weeds. I don't want you to worry too much about that. But talking a little bit more about heart rate, that is kind of a buzzword in the exercise community right now, and there's a lot of cool tools that you can use. There are heart rate apps, including Fitbits, Apple Watches, those kind of things that track this for you. And so, if you're looking at that content, I want you to kind of know what you're looking at. And so, really, like I said, we're trying to be at 65% of your heart rate max. And so to find your heart rate max, there's a lot of different theorems. The easiest way is to find 220 minus your age is going to be your maximal heart rate. And then you're going to take that times a percentage. So if you're looking for 60%, you're going to times it by 0.6. And so that should be, if you know that, here's a graphic here from the American Heart Association that gives it, because it is age dependent, right? It changes through time. So let's say you're 60 years old, your maximum heart rate is going to be 160. So that's a lot less than the 200. I'll just throw that out there. And then it gives you your zone, 50 to 85%. It's about 80 to 136 beats per minute. So right about there, you would want to be above 80 beats per minute, but probably below 100 to be at your 60% max. And that's just me guesstimating. But again, you can, if you have those Fitbit Apple Watches, those are popular nowadays, then you can kind of use that information to kind of know what you're looking at. And I do kind of just want to briefly talk about how to take your pulse. There's a couple places you can find it. You want to make sure you use either your pointer finger or your index finger, not your thumb. And my favorite place is on the wrist. So you want to do it on your thumb side. And I pick all 4 fingers, actually, just on the medial, kind of not that fleshy part, but in there. And you're just you can do it along with me if you'd like. And you're just going to push kind of deep into your wrist, right underneath that bone that's right here. And if you are quiet, you can kind of feel the bump, 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 bump. Mine's a little fast because I'm speaking, but then you're going to just time that for, if you do it 30 seconds, then you multiply by 2. That'll give you your beats per minute. If you do it for 15 seconds, you're going to multiply by 4. That'll give you your beats per minute. So kind of gives you a range. Obviously, if you're doing it by hand, you're going to do check-ins. You're not going to have it continuously. But you can kind of say, oh, I'm, too high, or maybe I'm not high enough and I need to do something a little bit more challenging. Any questions on this slide? Thank you. All right. And so what we've been talking about a lot is exercise. It's focused, it follows the FIT model that we've been discussing, and the goal is to improve exercise capacity. So for example, improve sporting performance. That's, I think, what most people think of with exercise is those big athletes that are fun to watch. Or in our case, reducing fatigue. But there's another more broader term called physical activity, and this still counts. So I really want to focus on this because I think this is more realistic and this is what our life looks like, right? And the goal is for movement. So example, household chores, just going for an enjoyable walk, playing with grandkids or children or dogs, all of that counts. So I don't want to discount that because it is also really important, and it's one way to reduce fatigue. And so that's when using this, you can still use the same scale. And I like it because it's a subjective scale, so it can change. So just because you're doing the same walk every day doesn't mean it's going to have the same score on our scales. Let's say, obviously it can change between people. So I might have a different score than Jess has on the same task. It might differ from day to night. Let's say you wanted to go for a walk in the morning and it sounds like it would be very light, 9. Well, in the evening, that might change to a 17, and then it's probably not appropriate because it's outside the zone we're looking for. It can change from different times of the week also. And when you start kind of keying into this, you start knowing your body, it allows you to plan. So you can look for patterns. You can prioritize tasks. You can make sure you're doing the things you need to do, then the things you want to do, and then those things that, maybe you can leave for later. Another way to think about planning your energy is to think about thinking about your energy as coins. So let's say you have 10 coins at the start of the day. Well, you did your necessary things. You got up, you took a shower, you cooked for the week or the day. And that took maybe 5 of your coins. Maybe that took, your whole morning and you used all those 5 coins. So you have 5 coins left, and you have maybe you have people coming over this evening. So you're thinking, okay, I could really do some yard work to prepare for them to come. I could pull some weeds or something so the house looks nice. And that would take 3 coins. So you have 2 left for your company. Or maybe you decide, you know what, I don't really care about the weeds. I am going to save those for when my company comes so I can be present and enjoy myself and not worry about running out of my energy for the day. Or, depending on how good of the friend is, just save it. And when they come, you can all do it together. And then you're doing, maybe it only cost you 1 coin and you're doing your senior visitor also. So that is one of those energy conservation tasks that ask for help, leave for later. Those it kind of helps you decide what to do. The other thing that I want to touch on for energy conservation is taking short, frequent rest breaks. And so this helps maintain your energy over a longer period of time. So we want you to stay in this somewhat hard to hard range. If the task you're doing starts to get into the 16, 17, 8, 9, very hard range, it's time to take a break. So maybe you're doing the dishes and you've done this big old load and you're almost done. You have like 6 dishes left, but you notice that you're starting to feel more fatigued and it's getting very hard. I want you to stop right there. Take 2 minutes, sit down, I don't know what you need, drink of water, something like that, and then come back to that task when you feel like you've recovered a little bit. It's going to be easier to take a 2-minute break rather than a 32-hour break if you kind of overdo it.
Alex, I want to chime in. We've got a private comment rather than question that is just applauding you for mentioning the importance of, these tasks that are energy sucks. You're not actively choosing to do exercise right now, but you are feeling fatigued from them, and you do need to assign this perceived exertion level so that you can, be honest with your body and take breaks when you need them. So that was a great timing for that private chat. Thank you, Kathy.
Awesome. Any other comments on this?
Oh, yes, we've got one more. We have one participant that says she's not quite seeing how the fatigue rating 1 to 10 correlates to the heart rate rating in the second column. For instance, does a fatigue score of 6 always equal the HR rating of 13 through 15, or is the fatigue score subjective?
So the fatigue, both of them are subjective. And that is a good question. And thank you for helping me they are very similar things. The 6 to 20 scale is supposed to simulate the heart rate. And so that's why they chose 6 to start at instead of 1. So that's the reasoning for the number difference. But they are the same as far as, like I said, with that example I gave, 160 beats for a 60-year-old is their maximal exertion. So then that would be all the way down here.
Got it.
Does that clarify it at all? So they're both subjective. They're just putting different numbers on the same verbiage.
Right. So that I think that tracks. And if not, please feel free to chime in on the direct chat one more time. Okay.
And I just chose to include the 6 to 20 scale because that is what's used a lot of times in research.
Okay.
And so you can pick if the 1 to 10 makes way more sense to you, then that's great. If the 6 to 20 jives a little bit better, then that's great. You can pick one or the other. And so kind of we talked a little bit about that energy saving. And so, now we kind of know what we're looking at. And I want to encourage you to find a tracking system, because the more information you have, the better you can plan, the better you can see what is helping you and what's not helping you. So, for example, this is a log that I found on a Moving Through Cancer website. And they have a lot of things listed, and it's important to include what you find important. So they have one here, the good day versus a bad day, the fatigue scale, 0 to 10, other symptoms. So, maybe this looks like maybe it's a headache guy. How's your sleep, 0 to 10? Did you move 30 minutes a day? Did you lift how many sessions? And what's your protein intake? So those are just some examples. Obviously, there is some variety to this, and picking what is important to you is going to be the most beneficial. So, you can use something like this. That's a weekly calendar. You can use your cell phone, your Google Calendar. We have a calendar up in our kitchen where I just kind of do check marks or have little symbols for these different things. Um, so that's something that you can play with to kind of see what works for you with those tracking the symptoms. But it becomes important in finding those, you know, maybe your weeks look very similar week to week, or maybe there's one task that really wipes you out for not just an afternoon, but 2 days following. Kind of trying to take note of that and making sure you're addressing it as you can. And of course, we did mention sleep. So I wanted to, that's another thing that can obviously affect your fatigue. Exercise was a moderate or had moderate evidence to improve it. And so other things that you can do other than exercise is to have a routine. Pick a time to go to sleep and to wake up every single day, even on the weekends. Have a specific routine. So that could be including like going to the bathroom, washing your face, brushing your teeth. It can be as specific as possible, or it can be pretty generalized. Like maybe you just read for a little while before bed, then use the bathroom, and then go to bed. And that's your routine. Something important is to stop your screen time at least 30 minutes prior to sleeping. That blue light can kind of induce wakefulness. If you can't fall asleep within 30 minutes of lying down, try to get out of bed and do your routine again. See if that, the goal is to get your brain to associate this routine with sleep. So it's kind of that preparation of calming down and shutting everything off in your head, not just in your house. Decrease disturbances. So you want to sleep in a dark room. Only use the bedroom for sleeping and intimacy. So this also helps with you training your body to kind of calm down in that space. Decrease napping and sugar intake. And 3 o'clock, I want to highlight, is kind of your cutoff time. So no naps after 3 and no caffeine or sugar after 3 is going to help that sleeping cycle. Also, naps shouldn't be more than an hour. And that can kind of help with you being tired enough to want to go to sleep at your bedtime. You can use relaxation therapy, including guided imagery, meditation, aromatherapy, and progressive relaxation. There's a couple different aromatherapies, like lavender is a good one. That's the one that I like and can think of off the top of my head. And then there are like different apps that you can get. I know Calm app is very popular. Sometimes I just look on YouTube and say, I'll type in YouTube 5-minute relaxation for sleep. It's free, it's easy. You can find one you like. You can try different ones. And then progressive relaxation is what you do is you start at your feet and you contract your toes as hard as you can so like you're doing this with your toes for a count of 5, and then you really focus on the relaxation part. So then you let go, and then you bring your toes up towards your nose and try to do that as hard as you can for 5 seconds, and then you relax and let it go. Then you point your toes as hard as you can. You just kind of work up with straightening your legs as hard as you can, squeezing your glutes together as hard as you can, bending your arms as hard as you can, squeezing your fists as hard as you can, scrunching your face as hard as you can, and then letting go. And so that can also help when you focus on that letting go, relax your body and get you ready for sleeping. Breathing, controlled breathing can also help. So if you want to exhale longer than you inhale is the biggest thing. So if you do inhale for a count of 4, you want to exhale for a count of 8. And then also trying to sleep in a cool environment is better for your sleep in general. This says 65 degrees is kind of something to try. But of course, comfort is important. So if you need it a little higher or a little lower, that is an option. Any questions on sleep? Okay. And so with all of these different tasks, I encourage you today to set a goal. This slide is taken from that handout from the ACSM again, and it gives you an overall statement. So overall, avoid inactivity and improve general health. Aim to achieve the current physical activity guidelines for health. 150 minutes per week of aerobic exercise and 2 times a week of strength training. So hopefully that sounds familiar. And I just want to encourage you that you don't have to start with that number. That might be your first goal, is 150 minutes a week. And so you can start at a little less and see what you can manage. So for example, maybe instead of doing 150 minutes a week is about 30 minutes per day. So maybe you just do 5 minutes after your meals of a 5-minute walk or march in place. It could be a variety of things. But you do that 3 times a day. So you're doing 15 minutes a day. So if you did it 5 days a week, you'll be a little short of that 150 minutes. If you do it 6 days a week, then you probably reach that goal. But then, you can add on as time goes on. Again, we're trying to be in that moderate intensity of somewhat hard to hard. And so if it starts to get to very hard, then it's time to take a break. So you can start really slowly with light weights and build up. If you track your progress, that's a little bit of an intrinsic motivator because you're able to see you're getting better. You're getting to see the fruits of your labor. And so I really encourage you to find a tracking system that works for you. And then, of course, hopefully these things will get easier as you go. So that means you need to do them for either longer or increase your weight because we still want to maintain that somewhat hard to hard. If it gets light to very light, then you're like, okay, I probably need to step it up just a little bit. And then another challenge, but something that if you can do it will make this so much easier, is doing activities you enjoy. So finding something that you like. Maybe it's not a task you like. Maybe it's doing it with someone you like. That can make a difference too. Finding a partner in this journey. But yeah, we are way more likely to do things we like rather than things we hate. If you ask me, you're not going to do it if you hate it. And so here is some, different ways. It doesn't all have to look the same. We're all following that same guideline, but here are some examples. Again, this is from that Moving Through Cancer website. But it gives 4 different people with 4 different ways that they achieve this 150 minutes per week. Helen rides her bike to the park on weekends for 1 hour and enjoys online dance exercise videos 2 days after work. Maria walks each day for 20 to 25 minutes. Malik attends a 60-minute ballroom dancing class once a week and goes to the gym on the other 2 days. Our asterisk is on non-consecutive days. That's an important thing. And then we have Earl, who does a 60-minute water exercise class and walks 30 minutes 3 times a week. So they're all doing different activities. They're all doing it for a different amount of time, but they're still hitting that goal of 150 minutes per week. And so next, I want to go into a little bit more of resources. So how can you do this? How can you hit this goal for generalized health? And again, this is from that Moving Through Cancer website. So this is nice because it has a directory of programs specifically for cancer patients or cancer survivors. And it does it by region and area. So I did go on there and looked at the Omaha area, and all the YMCA Livestrong programs were listed on here. So that was great. That was the main one I saw on the Omaha area. But if you are in a different area, you can definitely check this out and see what's out there. And so here it is a little bit bigger. And we'll go through, I kind of just took snapshots from these websites. And so we'll talk about the Cancer Exercise app. It's also for Androids on the Google Play Store. 2 Unstoppable is a website that I have on here. And then we went through the Moving Through Cancer website also. So here's that Moving Through Cancer website. If you look at the top, we're on the exercise videos and handouts. And so this is what the page looks like when you open it up. It has this nice header, and then there's different, these are seated exercise programs that you can do on YouTube, the lift program and the chair program. And then they have a handout for specifically that too, if you would rather just have it in your hand. This is the Cancer Exercise app that you can download on your phone. This one was kind of nice because it did some screening questions like, are you in treatment now? And based on your answers, it gave a little bit different advice on what you should be doing. I also liked this page because it had an intrinsic way to track your progress, including the 6-minute walk test and the 30-second sit to stand test, which are things I do daily in my job to make sure that people are getting better. And has this rating of perceived exertion scale, 1 to 10. And so it uses the same verbiage that we went over, somewhat hard to hard is the range that we're looking for. It also asks you before you start exercise, what is your perceived exertion, and gives you recommendations based on that answer. So I also really liked that option for this app. And then of course they had a resource tab where you could learn a little bit more about exercise, the benefits, how to do it safely. You know, obviously all of these resources are wanting you to be in a place where you can exercise safely medically. And so they do some screening for make sure you're following what we talked about at the very beginning, that if you need more supervision with these tasks, that you are getting it. And then this is this 2 Unstoppable website. It looked, I'm not familiar with this one as much, but it looked like they had 21-day challenges that were free. They had some YouTube videos. This one is specifically for aerobic exercise. And then they also had some like online personal trainers that were certified for cancer clients. And those did come at a cost. So you would just have to make sure what you were investing is what you wanted to. And it looked like a little bit more geared towards breast cancer specifically. And then I know Jess mentioned Live Strong at the YMCA. Amy Rowe was on here not too long ago, kind of discussing this program. It is a 12-week small group physical activity and well-being program provided at no cost. So another great resource. Their goals will be very similar. I think they do a variety of different tasks, activities, so you can find what you like. You can try a few things out with the goal of reaching those 150 minutes a week, 2 days of strength training, and building that healthy lifestyle. Another resource is we do have a cancer education and survivorship group at Madonna that I co-host, and I saw Kayla Cascadon was on here too. So we meet every second Thursday of every month from 3 to 4 at the Omaha campus. If you are interested, it's kind of it's a flowing group. So depending on the participants, we can turn it into a lot of different things, including educational topics. We can do some guided meditation, some wellness education and practice. We can do some of more leading towards this 150-minute week goal. It could turn into a lot of different things. So actually, I gave this presentation to this group first, so it gave me a little bit of practice. So if you do enjoy this and would like to continue on with some of this stuff, you can definitely join us every month. And then for my clinicians, I just wanted to touch quickly on the use of screening tools for fatigue. There is a clinical practice guideline specifically for this that takes a lot of the questionnaires and things out there and breaks them down into specifically who they are appropriate for, who they're effective for, etc. And then this one is a clinical roadmap, and it provided a nice little decision tree on which tool to use. So I just wanted to walk through that quickly. In general, if you can, activity can be a determinant of health. And so if you start asking, have you increased your heart rate in the last week to your patients on their visits? It's an easy question. It's a yes or no question, but it gives a lot of insight on their ability to function in their environment, on their health as an overall, um, ability to complete what they need to. So what's nice about this decision tree is they have kind of two different categories. There's a screen for fatigue and a way to assess for fatigue. So when you look at the screen, they gave 4 options, and there's a simple screen or a multi-system screen. They're listed there, and they go into more detail into the in the document. So if you want to reference this, please do. But if it's positive, if it's negative, then you just continue to monitor that fatigue regularly. If it is positive, you want to refer to a medical workup as needed. If there is a medical reason for fatigue, like anemia that we talked about, then you want to treat that first and then continue to monitor. If there is no blatant medical reason, then you want to assess for fatigue. And it gives you different ways to assess. So you can either assess based on the continuum of the care continuum, the type of cancer, or the language that it's in. And it kind of breaks it down into what are your options there. And then you can determine the type of fatigue. Is it emotional or cognitive or physical? And you can make the appropriate referrals based on those answers. At my facility, we use the FACET fatigue. It's nice because it has a cutoff score. So you know if they score above a 34, or sorry, it's actually below a 34. It's kind of opposite with the FACET fatigue, but if you score below a 34, then the fatigue is greatly affecting their life, and 10 points is a clinically significant difference. So you can see what we doing working in the long run as you retest. So any questions on this specifically? Awesome. Okay, so that's the end of my presentation. I would like to open it up for questions. I have my email address up there if you have anything that you would like to reach out for, if there's anything specific to the survivorship group, or in general, something you don't want to ask on camera, you can email me and I'll get back to you. I'll show my resources really quick and then head back to this page. So.
Perfect. So while she's got the resources up there, I can ask the question that was in the chat, Alex. Allison would like to know if those currently going through treatment are able to participate in each of the programs you mentioned. Do you have feedback on that?
Yeah, so the app specifically asks, are you going through treatment, and then gives you specific recommendations based on that. I would definitely discuss with your provider, depending, you may have more of those medical reasons for fatigue as you're going through treatments. So making sure that you're on top of those reasons. But yes, the short answer is yes, you can participate. A lot of I know Livestrong will take patients that are going through cancer, patients that are currently going through treatment. I know that the website specifically had stuff for people who were going through treatments. So, I would steer towards those resources that provide, say, yes, we want you to, but yeah, exercise and activity is still very important, even going through cancer treatments. It takes a lot of energy to heal. I know that, but if you're able to maintain your strength and endurance, you're going to have a lot better outcomes with your function ongoing. I treat people that are going through treatments ongoing, and I see a lot of functional improvement despite their, regimen. So there's potential to improve, and there is a lot of benefits to doing it.
I'll give you all some time to ask a few questions in the chat. And while you guys are sorting out questions, I wanted to share a little bit about A Time to Heal. A Time to Heal offers completely free resources to cancer survivors and caregivers, as well as these monthly webinars that you're attending, we also have research tested information that we can send out to folks that would like to sign up for our survivorship class. And so what we say when we are referring to survivors is anybody that's been diagnosed with cancer and is still with us. So it doesn't matter if you're actively in treatment or if you are, nearing the end of your cancer journey and are just trying to get back to life as normal. Our Survivorship 101 program is a 9-week, once-a-week program led by a medical professional that we've trained specifically to facilitate our research-tested information. We ship the books wherever we need to ship them so that we can reach survivors all over the world. But we also treat folks or work with folks directly here in Omaha on site at our offices off 90th and Dodge now. You can join us for classes. Again, these are once a week for 9 weeks on the survivorship program side. And we talk about things like exercise, like nutrition, like depression and anxiety, managing your fear of recurrence, and also just getting back to life after cancer. And we also have a brain fog program. So if you're experiencing brain fog as a result of chemotherapy, or we've also had folks benefit from our brain fog program that experienced it through after long COVID. We do have a brain fog program that's a 6-week, once-a-week program, also available both virtually online and or in person. And I will share the links to our website in the chat. And that said, if you have any questions about A Time to Heal, I'd be happy to take those offline. And we do have one more here for Alex. If you've got any questions, please feel free to continue using that chat box. Alex, Joni has asked what the discussion was before the Cancer Exercise app. So I might just make sure that I get Joni the slides, but
I can go back to.
Sure, yeah.
See. Yes, so it's called the Cancer Exercise app. And if you look for it, it kind of has this blue. I should just probably pull up let me show you it. I downloaded it on my phone.
That's actually okay. I think if you want to go back one more step, actually, Alex, I think she's asking right before this if it was.
Oh, this one.
Yeah, so it's just
Okay.
those list of the resources, Joni, that's where we were at.
Gotcha. Yeah, so there are links, and this was found on, it was found in a guide to getting started and active during cancer treatment, moving through cancer. So this should be found on that Moving Through Cancer website. It comes in like a little packet. And at the end, it had some online resources. So if the specific links, that's where they are.
Yes, perfect. That link is also in the chat, everybody. If you scroll back up. What other questions do we have? You all also have the option to unmute yourselves. If you would like to ask live, please feel free. Okay. We'll give it a couple more minutes, but Alex, do you have anything else that you'd like to add or anything that you'd like to say first to our survivors that have joined us today? Anything in particular you'd like to offer them as a summary or just a quick send-off message?
Well, I would just like to say thank you for this opportunity. I think that, hopefully I made it a little bit, I gave you some background on why it's important, and then also hopefully made it available to take the first step. So thank you very much.
So Alex, I have just a quick question about hydration.
Yeah.
So how much, I guess, is kind of appropriate during exercise?
Yeah, so I think drink when you're thirsty is a good thing to go off of, specifically during exercise. You want to get a lot of times it's like half your weight in cups is kind of a recommendation in general. Of course, if you have listen to your doctor first, depending on your sodium intake, that might be different. But then also, I think a good rule of thumb is drink when you're thirsty, specifically for exercise. If it's available, and you notice that it's a break and you're like, oh, I could use a drink, then that's great.
I am just wondering, you were talking about that avoiding activities, right? And then you says we can do whatever we can, like housework and whatever things. Does that include what you were talking about, 150 minutes per week thing, or does it have, we still have to go to exercise and aerobic kind of things?
So, right, the 150, your physical act, so that's the difference between exercise and physical activity, right? And so your physical activity still counts to that 150 minutes per week.
Okay.
And, like I said, the overall goal is to avoid inactivity. So if you're up and moving around, all of that counts.
Sometimes you're so tired you cannot even go to Y or whatever to exercise, but it just,
Yeah.
if you can do even little walking at home and doing the different things and washing dishes stuff, that'll be much more manageable.
Yeah, definitely. And, I encourage you to use that scale to plan it. So if you say, oh man, going to the Y feels like it's going to be very hard, that's over your moderate intensity. So you need to find something that is in that somewhat hard to hard range where you're going to get all those benefits of the activity without, getting too far into it. So yeah, if you say, I took a walk around the building or down the hall, or, if you have a lap in your house or your room and you just do circles around that and you did 3 circles and it's getting to be very hard, so then it's time to take a rest break, that all counts.
Thank you.
You're welcome. It looks like Steve has his hand raised. Is that on purpose?
Yes, Alex, thanks for all the info today. I'm a cancer survivor. Livestrong, you've mentioned that a lot today. I can't say enough about that program. I learned about it through a Time to Heal webinar on the weekends. I've worked with Amy Rue. She came to a lot of our classes. What a wonderful program that is. I hope the medical personnel that are listening today encourage something like Livestrong. It's really helped me. It's changed my outlook on life and physically, mentally. And I've met, like 8 new people that I see every week that keep us all accountable to exercise and continue to go. So I just wanted to put that out there.
Good. And you're reaping the benefits, which is the best part, right?
Yes. Yes.
Great. I'm glad to hear it. Thanks, Steve.
Yes.
Okay. Well, I hope folks can still hear me. Maybe.
Right.
Just having some connection issues here. Hopefully we can still get this rounded out.
We can hear you, Jess.
I don't know if you folks can hear me. I'm just having some troubles with my connectivity. I'll do a send off via chat, but thanks everybody for coming.
Thank you.
There we go.
Oh, we still open.
All right, I think, I don't know if everybody heard, but Jess said that we're wrapping things up. There weren't any more questions in the chat. And so thank you again for attending. Again, if you need any questions, you can forward them on to me or to Jess at A Time to Heal. So thank you very much.
Thank you for great time.
Thanks, Alex. Have a nice day.